Go.
Hi guys, I'm Aditya, and once again, after a long time, I'm here again today with Dr. Ekansh and Dr. Anirudh from the Your Mentor team. First of all, to begin with, I would like to congratulate my colleague and my dear friend Ekansh for clearing his FRCS examinations at Edinburgh.
Thank you so much, guys. Thank you. Big, massive relief.
Very good. Congratulations on that. Today, we've got a very interesting topic that we want to cover today. It's going to be a very short video on orthopedic training in India. So the question we want to ask today is your training enough? So the idea behind why we want to ask this question is that well, at the moment, we're trying to assess the current experience of the recently graduated colleagues of trauma and orthopedics in India, whether they're finishing their PG or they're in their senior residency. We want to know exactly what's going on in the training scenario in India at the moment. And the reason for that is because while working in UK, we've realized that there are certain differences that we've seen. And there are certain questions that we do need to ask with regards to training in India at this time. We all know that the field of orthopedics has rapidly evolved over the last few decades, whereas the training programs have remained the same pretty much about 3 years with similar working conditions and the similar curriculums. Furthermore, there's a lack of uniformity in the training, whether it is your MS or your DNB or DORTH. Other factors that could affect your training are whether you're from a private or a government institute or what part of the country you're from. Other than that, as compared to the UK system, there is really no feedback with regards to the training as how the trainees are feeling, whether they feel that their training is sufficient, what they're doing in their training. In comparison to UK, where most of the training is trainee led and it depends, and the needs of the trainees are highlighted and reflect in the national training leads. Whether you're in the north part of the country or the south, the training is pretty much the same, which is very different, which is a very different scenario as compared to where from India. To address these questions and to provide an area of and a formal platform for feedback, we have come up with a survey for all our colleagues who have recently graduated or are still undergoing their graduation in post-graduation in trauma and orthopedics. To talk about the survey, I'm going to leave the stage. I'm going to leave the stage to Anirudh, who has designed the survey and is going to talk to you about it now.
Yeah, thanks, Aditya, and congrats to Ekansh once again for the FRCS exam. So we've designed the survey basically to cover exactly what Aditya's spoken about. So the survey comprises basically 6 sections, and we've tried to broadly assess all areas of your training. So this includes your clinical exposure during your training, the academics and teaching that you've received during your training, your surgical skills, how you've developed these over your training, and also certain questions about your work environment, and also what the current day trainees' goals are following their training. And even though this sounds quite a lot, but this is a very objective, very condensed survey and shouldn't take any more than 5 minutes to complete if one started. And Ekansh will speak a little more about how the survey will help us.
So thanks, guys. Firstly, something we've picked up is that there's usually no voice for the trainees in India to feed back to the system about how they're faring with the training that they're receiving over the period of 3 years or even further into their early years of senior residency. This attempt by us is actually, to our knowledge, the first attempt in India to actually bring together the voices of all the trainees and the young orthopods to let the system, the governing bodies know what the people are actually experiencing, what are the advantages, and also the deficiencies that the system lacks. As we've already pointed out, that the orthopedic field has advanced rapidly and it is continuing to do so. At one point, it used to be an end branch, but I think as of now, everyone will recognize that it has been broken down into subspecialties ranging from spine, arthroplasties to arthroscopies. And we want to assess whether the training that we're receiving during our MS or DNB or in the early years of senior residency is actually catering to that demand today, or is that leaving people short-handed, making them look for fellowships. Please use this survey as an opportunity to voice what you've experienced. Let us know what you felt are the shortcomings, and we will use this to formally feed it back to the system. And we will continue to collect this data over a long period of time. We also have some good news to announce for this, and Anirudh will break the good news to you guys.
Yes, so we put the survey out there for the last few months now, and we're happy to announce that the initial results that we've gathered from this survey have been accepted to be presented at the Indian Orthopaedic Association meeting next month in Goa. This is a very good opportunity for us to raise this topic for discussion at a national meeting. And hopefully, this can initiate further discussions on how the system needs to be improved, and if at all there are any areas specifically that need to be looked at, that can be addressed, at a national level meeting. We request you to keep on.
Just take out some time for a few minutes to fill the survey, keep feeding back, and we will keep collating these data. And right now we have over 100 responses, and at the IOA, we will finally have a chance to actually voice our concerns to the senior orthopedic surgeons in the country, and hopefully bring about some constructive change for us and also for our junior colleagues.
We're going to leave the ortho survey link down below in the description. I invite everybody of my colleagues and my juniors to participate more and more, so that we keep continuing to collect this data, and we have a more robust data set to collect, and hopefully take it forward in the future to the relevant authorities. At the same time, I invite you all to share your thoughts, your comments, your experiences in your PG. If there's something specific that you want us to highlight or talk about, you can email us on yourmentor121@gmail.com, or you can leave it in the comments down below. And we would be grateful if you could share this video as much as possible, like and subscribe to our channel.
And I would like to thank from all our behalves for all the people who've given us a lot of warm feedback. We're getting a lot of questions in, and we're trying our best to respond to them as quickly as possible, and as be as helpful as we can. Please continue to do so, and we will keep trying to do our best as well. That's it for this video, but we will be back very soon with many more videos and giving you back more information. Good night.